My name is Dr. Tasdik Hasan, and right now working as a research investigator in Infectious Disease Department of ICCCAD. The ICCCAD stands for International Center for Diarrheal Disease Research. And I have conducted, recently I have conducted a study on mental health as a part of my postgraduate diploma in disaster management. Before that, I've completed Masters in Public Health from American International University and MBBS from Schulte Medical College. The first thing is, in Bangladesh, mental health is a very neglected and hidden topic of interest as well for the physicians, for the public health workers, and for the policymakers definitely. Because the thing is, whenever it comes to disaster management, like health initiatives after disaster, the first thing comes to our mind is emergency support, the trauma management, and sometimes it ends up to only with the trauma management things. But after disaster, people are suffering from different types of mental health because they had to see a lot of dead bodies. They suffered from long-term consequences after disaster too. So mental health is a very important topic after disaster, though in Bangladesh we have a very less number of mental health researchers and mental health physicians as well. And for me it is a very, I think it's a topic to my very close to my heart, because I'm working with mental health issues for more than 3 years now, and I have a planning, I think you can say it, my dream, that I want to incorporate mental health issues in every field I can. And disaster, I think a very good start for that, because after disaster the area is still unexplored. What supports they need, and I believe that by very small, I think low cost initiatives, it can be minimized, and very it can be new innovations can be made to support these people. I had an opportunity to attend a workshop on mental health first aid. So I think that is a very wonderful initiative. Can be done, it can be taken by the government as well. Like if they can create volunteerism is the strength of Bangladeshi disaster management. As you can know that after any disaster, the people who are getting support from the governments, the more people are getting support from the volunteers. So if we can create a group of volunteers who will be trained on first aid as well, mental health first aid, so they can identify the people who are suffering just with acute mental health problems, and they can give support, not only the treatment, like not only the drug they are needed, but the social support, that these people need social support and you can take care of him. Maybe isolation, some people needs to be isolated for a time being, and then they needs to be in social contact. So these things need to be identified, and I think young people can play a vital role in that. Yes, I really feel there are a lot to do by the young people. So definitely, I am considering myself as young to now. So definitely, by my research, I don't know what happened after, if any disasters. I hope there will be no disaster in Bangladesh. But if it happens, definitely we need to work forward, and we all need to work. And I think ICCCAD can play a vital role in that, because ICCCAD is working on climate change and disasters, and mostly impact of adverse effects of climate changes. So I think multidisciplinary actions by ICCCAD and other organizations, it can play a vital role.